In this video, we're going to cover the 2 quiz questions from the prior video, a case of acute pancreatitis on CT, and I'm going to give you 2 more quiz questions. So the first quiz question we're going to cover is this set of MRI images of the C-spine T2 weighted. This is an example of Hirayama disease with the abnormality in the cervical cord here and here. The second quiz question was asking what sign this was, and this is an example of the Sister Mary Joseph sign with an umbilical lesion over here. We'll move on to our CT case. So we're going to take a quick scan through the case, and we can already see some abnormalities, but we're still going to go through our regular search pattern. We start off with the liver, looking along the right hepatic lobe and then along the left hepatic lobe. We do see a few sub-centimeter hepatic hypodensities, which are too small to characterize and most likely benign. They do appear to be in continuation with the biliary system and may just represent some focal biliary enlargement. We'll move next to the spleen, which appears normal. We go to the pancreas, which is abnormal in appearance. There is a lot of peripancreatic inflammatory change with this fatty stranding and some free fluid in the retroperitoneum over here, over here, over here, and also extending into the peritoneal cavity over here. We don't see any complications associated with acute pancreatitis, such as portal venous thrombosis. The splenic vein looks patent, and we don't see any kind of pseudoaneurysm with the adjacent celiac or superior mesenteric artery branches. We're going to move to the gallbladder, and that is surgically absent. We can see some cholecystectomy clips here. We move to the adrenal glands on the right and the left, which appear normal. We take a look at the kidneys. On the right, it is incompletely visualized. We do have a few hypodensities here, which are also sub-centimeter in size, too small to characterize and most likely benign. Left kidney is normal in appearance, no evidence of obstructive uropathy on either side. And then we'll take a look at the provided images of the gastrointestinal system. And the gastroesophageal junction looks normal. We see some layering food debris within the stomach. The stomach appears normal. We take a look at the duodenum, and there appears to be some bowel wall thickening, which is most likely reactive to the adjacent pancreatitis. We follow the duodenum across the midline, and then we're going to take a general look on the left to evaluate the small bowel, and on the right to evaluate the small bowel. There isn't much small bowel here. And then we'll take a look at the large bowel and try to follow that through its course. And the large bowel appears to be within normal limits, possibly some diverticular disease here. We're going to look for any lymphadenopathy in the porta hepatis, in the peripancreatic region, and then along the aorta, also evaluating the aorta at the same time. And we can see the origins of the celiac artery, superior mesenteric artery, renal arteries bilaterally, and everything appears normal. We move on to the lung bases, and we see some dependent bibasilar airspace disease here, most likely passive atelectasis. And normally I would put this on the lung window and look for any other evidence of lung disease, but I'm not able to do that on this screen at this time. Look at the spinal canal for any obvious abnormality, and then I would also put this into bone window to evaluate the bones, but again, I won't be doing that here. So this is an example of acute uncomplicated pancreatitis. We'll take a look at an example of acute necrotizing pancreatitis, and we won't go through the entire exam here, but I'll just draw your attention to this defect within the pancreas. this hypoenhancing defect, and this is an example of necrotizing pancreatitis. It doesn't enhance like the rest of the pancreas. Now you need to have IV contrast on board to evaluate for necrotizing pancreatitis. Additionally, a normal appearing pancreas within the first 48 to 72 hours of symptom onset does not rule out necrotizing pancreatitis. So those are our CT cases for today. We'll go on to the quiz questions, and the first quiz question is this skull radiograph, the Waters view, and the question is, what is the sign and what does the sign imply? We'll move on to our second case, and this is a coronal T2 weighted MRI of the brain, and the question here is, what is the diagnosis? So that's going to be the end of the video today. If you liked it, then give it a thumbs up. If you want to see more and be notified when I put out more videos, then click on the subscribe button. Thanks and take care.